one of the National Social Prescribing Committee members. It's amazing to be here 7 years on from starting the network in Yorkshire and Humber. So I also have a role in a regional capacity, facilitating the network, as well as being a committee member. Teacher on the social prescribing qualification in partnership with Bromley by Bow and University of East London. And also work for a programme of quality improvement at NHS England called Time for Care. So that's me. I'm really pleased that we've got Jo, who's my co-chair.
Hi everyone, I'm Jo Ward. Like David, I sit on the steering group for the conference. And also like David, I'm part of the National Social Prescribing team at NHS England. We're slightly different then in that I also work for a healthcare partnership, and I'm a social prescribing creative health lead for a local maternity system in Cheshire and Merseyside. And I also am a massive museum and library advocate and work within the museum sector as well. So that's me in a nutshell, and I'm really pleased to see you all today.
Excellent, thanks Jo. So really we want to just kind of get a bit of a snapshot. So you'll see we've got Mentimeter open just to try to understand where you are in terms of confidence. It'd be great if you could use the Mentimeter code by using your phone or browser. You can go to www.menti.com and use the number 66709280 to join that particular Mentimeter, and we will revisit it again towards the end. And we'll be asking you some other questions towards the end. So we would like you to use that if you can. There is a link in the chat. If you've just joined, you can get involved that way. But that's the kind of evaluation process that we'll be using for today's session. Jo's going to take us through the aims of the session. So back over to you, Jo.
Hi everyone again. Yeah, so today we're really interested in focusing on how do we harness assets in communities, and what we feel very strongly is that museums have huge potential for supporting well-being and all types of well-being really in relation to people's sense of belonging and reducing isolation, but also in terms of the collections they hold, how we create a sense of place and sense of knowledge. So what we think is that we hopefully will give you ideas and links so that we'll have museum on prescription absolutely everywhere, and we'll leave you inspired when you've listened to our speakers today. So the other element that we wanted to do was to explore how this event actually came about. So as someone involved in museums, we really decided to take a bit of a historical focus. So I'm just going to tell you a little bit about the history of the museums for wellbeing in Yorkshire and Humber, and the investment through Museum Development in Yorkshire that made that come about. And then David's going to tell you a bit more specifically about an activity through a partnership between Museums Development in Yorkshire and also the local social prescribing system that he facilitates for NHS England. So about 6 years ago, Museum Development Yorkshire realised that there was a real need for exploring wellbeing and building links with regard to health and well-being, and that was on several counts, in that they saw the opportunity of exploiting synergy between museums' aspirations to ensure that they attracted all members of the community. And it's a good example of where language can be both a barrier and enabler. So within museums, they talk very heavily around a social justice agenda and audience development. In the same way that we talk about health inequalities and early access to patients and prevention, the two things really come together within a museum context, in that you can, through joyful experiences within a museum context, bring in communities that the museums hadn't already been served by working in partnership with health and broader partnerships around social prescribing. So today's session is very much around that 5-year commitment. As a result of ongoing conversations with museums over the last 5 years, we've seen some real flowers. So if anyone was at the social prescribing show, you'll have seen York Archaeological Trust archaeology on prescription. The Yorkshire Sculpture Park have run a whole range of activities around NHS staff wellbeing, and not to steal Liz's thunder, she's going to take you through some really exciting examples in addition to our speakers today. So what happened was I approached David and said, we've got these fantastic museums, we need to connect them to your link workers. And then David, I'll hand over to you to tell you how that happened.
So one of the roles of the regional facilitators and regional learning coordinators is to try to connect social prescribing link workers up with learning events. We've been running those, of course, for the last couple of years virtually, and as Jo had so many contacts in the museums over in our area, and definitely a passion and enthusiasm for the subject, very infectious, was really able to sort of get on board with connecting the social prescribing link workers up that we have in the region with the museums that Jo has. And so I'm quite lucky in Wakefield. We have quite a few things going on. We have the Yorkshire Sculpture Park. We have quite a few community museums regionally. The Hepworth is another notable one, but we're sort of really quite rich in museums. The opportunity really was to try to connect up across the region social prescribing link workers with the museums. So we developed a sort of booking system for Eventbrite, and one of my colleagues, Kate Pearce, helped to try to match up all of the social prescribing link workers with a museum. And then on the day, we tried to put them all into breakout rooms so that there was a sort of effective speed dating between the museums and the social prescribing link workers, and an opportunity to try to connect people up. If anybody's worked on Teams and run breakout rooms, you'll know that you can't do much organisation for breakout rooms in advance. So it was a bit tricky. While we had the wonderful Ruth and Ranmali talking about their experiences of running social prescribing in the museums, which we'll hear about, I was sort of behind the scenes trying to kind of look through the list and match people up and put them in breakout rooms. Then following that, we had quite a few follow-up emails, people saying, oh yes, I really want to connect with that one. In my room, there wasn't somebody who was from this part of the region. Could you connect me up? And it just kept going and going. A good few weeks after that, still getting emails from people kind of wanting to connect up. So it had a real impact. It had a lasting impact. And in fact, I think out of 30 or 40 people that we had on the day, Jo, there was just such a buzz about it. Really good, positive feedback on the day for those experiences. If you are just joining, you might want to take part in our poll, because we're just trying to get a bit of a snapshot of how confident do you feel about explaining museums of prescription, because our role on the day was to try and increase the confidence of our social prescribing link workers to connect with museums, and for museums to host those social prescribing link workers. So I think in terms of a bit of a sort of summary of what we did and what were the outcome, I think that's enough to say for now. So I'm going to now hand over to Liz, who from Museum Development Yorkshire supports us around the regional infrastructure around the museums. And we're very lucky to have Liz today sharing her experiences. And, you know, we couldn't have made the event happen without Liz and Jo supporting from the museum side. So thanks, Liz, over to you.
Okay, welcome everybody. Thank you very much for giving me the opportunity to speak. I'm not very good technically, so I really hope this will work, so please bear with me. I've got 10 minutes to talk a little bit about Museum Development Yorkshire. Okay, so we're a museum development provider, and we support museums in Yorkshire and Humber, but I presume quite a few of you are not from our region.
I think have we lost Liz? She's frozen.
I'm back.
Oh, she's back.
you're back.
There's also a problem. There are also providers in Scotland and in Wales. I've put the links in the chat. We're funded by the Arts Council to work with museums that are accredited. It's a benchmark. For example, for Yorkshire Humber, I've got about 125 potential clients, and there's a team of 6 of us working with them. We're funded by the Arts Council at the moment until 2023, and we're looking to support them in a variety of ways all across museum business, but actually working around health providers is a really important part. So I just wanted to take a couple of minutes just to talk about previous work that we've done. If after that you think, well, I'd really like to contact my museum provider, there is a contact within the slides, or if not, just search for Museum Development Network UK and they'll come up with your provider. We all work slightly differently, but there will be somebody out there to help you. Okay, so what have we done? Well, over about 6 years, we've worked with over 40 museums. I've got a case study that I've embedded in a document that I've embedded in there. So if you get a chance, if you have a look at that, or visit our website, which is museumdevelopmentyorkshire.org.uk, you'll find the case study document there. So in about 2015, I ran a conference, and then I started working with Jo around about 2016. And since then, we've been running a cohort of museums, on average between 5 and 8 museums each year that we work intensively, and their museums are specifically looking to support the potential visitors and present visitors using their assets, what they've got, their collections, their expertise, their galleries, their green space. Maybe there's sometimes that some of them, David talked about Yorkshire Sculpture Park, so you've got a bit of blue prescription there as well. So they use whatever asset they've got to work with the local community. So here we've got on the right hand side, I think it was somebody who was called Ivy from North Lincolnshire Museum, and they worked with, it's a triangle washing mangle, if you can tell in the background, and they're using that in a reminiscence session. We've seen over the years that it's really evolved, and actually we found that when I first started doing this, was a real focus just on reminiscence work with people with early stage dementia through to midterm, and as it's progressed, we found that actually there's been a lot of museums have been open to a lot more opportunity. So at the present moment, a lot of my museums are working with small groups, particularly around supporting their mental health, which is becoming even more prescient, obviously, as we move out of the pandemic. But I just wanted to talk in depth a little bit more about a couple of our projects. Okay, so in more than a couple of years back, around about 2016 to 2018, these 2 projects are. So Scarborough Museums Trust worked with a housing provider and they really targeted, we funded them to develop a handling box, and they worked with some a reminiscence worker and also an outreach worker who's particularly skilled in role play. And storytelling, and they worked in a variety of community resort sites, just the way probably that you do as well, with socially isolated older people. So the project, the intention of the project was to really to bring together people that often didn't know each other from different sheltered housing schemes to really develop some friendship groups. On the right, we've got a project from Harrogate Museum Service and Ripon Museums Trust. So there are about 5 museums in that conglomerate working together, that consortium. And they worked with the North Yorkshire provider called Dementia Forward. And here we've got one of the projects that they run. This was actually with a clay artist and a practitioner from the University of Sunderland, actually, working around tactile clay therapy, they called it. So using the collections from Ripon Museum Trust and getting the participants, most of them were in mid-stage, really to develop a piece of artwork as a reflection of that. So really kinesthetic. Yeah, and I think if you're wondering what would museum as what's the point of working in museums, at the end of the day, what we've got are collections, and they can really bring things alive. And you can use them in very different ways. So maybe if you've got people that are stroke survivors, you know, they've got aphasia or something like that, it could be just more around language development, for example. We're working with people, young people with mental health challenges. We've worked with people who are neurodiverse. So lots of different ranges from our collections. But in this case, on the right, it was a 6-week programme. They met for half a day every week, a specific discrete group, and they toured the sites across Ripon Museums Trust and Harrogate Museum Service, and they had an activity. So that could have been massage, it could have been aromatherapy, it might have been a role play in the Victorian classroom, lots of different opportunities there. So that's just one more in depth for you. And then as we move on, I'm near the intimate thing. I wanted to expand it all and really for you to think, really, I'm sure most of you are very familiar, or you work very much from an asset-based approach, which Jo introduced me to, oh gosh, many years ago. And now I'm very evangelical about it. And I think that's where museums can really fit. That's the space for you. Because on the left-hand side, we've got Bankfield Museum, who worked with a provider for adults with who had different mental health conditions. 4-week programme based in the museum, incorporating different things. So whether they were using the galleries for yoga practice, whether they were inspired by the collection and they decorated some chairs, whether they looked at mindfulness. A lot of our museums are looking at mindfulness, whether that be guided work around artwork, slow looking, for example, or guided writing classes. And on the right hand side is East Riddleston Hall, which is National Trust property in West Yorkshire near Keighley. If you've not been to either of those, all of them, I'd say go. They're fantastic places. But we part funded their Wellbeing garden, which they specifically were targeting as a place of contemplation and just relaxation. So that's just a snapshot of what we have done. Unfortunately, I won't be able to stay for questions, but if anybody has got any questions, I know Jo will be able to take them for me. She's worked with the programme for a long time. But if you do have any specific questions or do you like more detail, that's my email. Do get in contact with me. If you're from outside the region and you wanted a contact in another region and you can't manage to sort it out, drop me an email. I'm more than happy to broker a relationship for you and put you in touch with another provider. As I say, another one of the providers across England. I can also to put you in touch with people from the Northern Ireland Museums Council, if anybody's here from over there, or Wales or Scotland. But hopefully I've indicated the opportunity. And I would just say as well that particularly as we move outside of a pandemic, that museums are far more mindful of the importance of well-being. Perhaps they're not doing so much around health, obviously, but they are very focused around well-being. They're really interested to work with people, and they, as long as your agenda and their agenda can actually, you know, if you've got shared outcomes, I find that a lot of them are very enthusiastic to work with you. What they're looking for is your professional expertise and support going forward. So, you know, do get in contact with either myself or consider thinking about working with your local museum, whether that be through their handling collections, whether that through their expertise, a guided session around their art collection, or maybe even just using their space for some sort of contemplative work. Okay, but thank you very much, and I do hope to hear from some of you. Thank you very much.
Liz, before you go, could I ask you a question? I just wonder, in terms of the wellbeing focus, from your experience of the cohort, what do you think have been the most important elements to support museums to do more around health and wellbeing?
What they're always saying, and I should also say as well, they are going to be much keener on it because the major funder, Arts Council, they've got a new 10-year strategy called Let's Create, which is 2020 to 2030. And one of the key elements of that is about stronger communities. And there is a real focus on wellbeing. What they're really interested, though, is getting to work with people. So they know about social prescribing, they're really interested, but they want to make sure how that they can link with those groups. Okay, they plan a lot in advance, so they're looking for a commitment and something that they can agree moving forward. I think they're very keen to look at developing and sharing their spaces, but they do need a bit of commitment. You know, also, of course, if you come with some funds as well, if you can bring in some expertise, they might look to be able to joint support things, and then you can lever in some expertise and finance. At the moment, I think there's a real focus on mental well-being, and I'm getting far more interest and questions around neurodivergence as well. So, but from an actual link work and from people around social prescribing, I think what they want is consistency. They want a kind of a shared agreement, and probably the best thing to do is to, you know, contact them, arrange to go and see the museum and find out what the collection and what they can do for you, and broker an arrangement. I mean, Jo, you've worked with the museums for over 6 years now. What's your reflections? Have I missed anything out, would you say?
Well, no, I think you've hit the nail on the head in terms of the new Arts Council funding and the policy around actually documenting that we are reaching socially, economically disadvantaged groups. And that's a definite bonus in relation to any joint applications for funding. But I just also wondered, what I'm always surprised about is how good a secret it is that how much work museums do with children and young people, and particularly around early years. And I know certainly Yorkshire does a lot, and from recent presentations, we've seen lots of work in Cambridge and really across the piece. So again, I suppose it's to emphasise that almost agendas are coalescing, because in February, NHS England launched its commitment to children and young people social prescribing programmes. And one of the big concerns from NHS England was, are there any wellbeing journeys out there? As we've seen, as Michael pointed out, Michael Marmot, the cuts in Shore Star centres. But in reality, we've got all this work that's been going on for many, many years, from time immemorial around children and young people. That's a real opportunity to harness. So I suppose, and I'm not wishing to steal the Thackray's funder, that it's not seeing museums as just about the collections. It's about that space that they've got as well, and that expertise. But
Yeah,
I mean, also the issue
that
about partnerships and understanding language. I think one of the things about the session that David organised, we don't get together enough, do we? We all operate in silos. So museums meet with museums, and the NHS meets the NHS. We need more of these cross-sector forums where people feel confident to ask what seems like a daft question, but is actually probably the most important question you could ask.
I mean, I can see Julia's here, so I'm sure she'll be talking about National Museums Liverpool and what they've done across the life course, if you like. But what I would say is, when you mentioned the fives, I mean, museums are really keen to look, you know, at the kind of whole element, the kind of gestalt. So they would really be interested in working with new mothers, for example. So don't just think, oh, it could be a drop-in session. There could also, of course, be cross arts as well. A lot of museums work with library sector, and of course, public library sector are very well skilled at working with the family audience as well. So there's lots of potential there. And as Jo says, yeah, you can build. I mean, I used to work in museums. I was a trained teacher. I moved out of teaching and I've moved into museums. So you've got a lot of expertise within there, and we've got a particular, I think what museums I would say are particularly skilled at are working intensively with small groups. And I think by working with in a more a social prescribing model, if you like, they can justify working intensively with small numbers. I mean, the challenge would be is around how you evaluate that and how you capture that, and making sure that your kind of evaluation models link with the museums as well. But that's all through discussion, and I think you'll find that museums are really enthusiastic and really see that they're not in isolation anymore. They see themselves very much as part of community. Yeah, and that's your job as well, isn't it? So I can see there is a real synergy together.
That's brilliant, Liz. Thank you so much for setting the context. Sure. And we're going to be able to put a bit more meat on the bones. So I'll introduce our next speakers. in terms of a spotlight on social prescribing actually in museums, we've just got some amazing examples, and particularly today, the Thackray Medical Museum and linking Leeds, which the conversations were happening over a period of time, and certainly the Thackray was one of the early cohort partners for Lizzie's groups, and that's the other thing that's been really important, that we've managed to bring together language. So when the NHS talks about co-production, we just like to say museums have been talking about it for an awful long time, and they practice what they preach. So without further ado, I'm going to hand over to Ruth and Sue to talk about their joint partnership and just an amazing coming together that's actually added real value for everybody within the area of Leeds.
Thanks, Jo. So I'm Ruth. I'm one of the locality managers at Linking Leeds. We're a citywide social prescribing service. So we work across the whole of Leeds, and we work with just over 500 people every month. So yeah, we serve quite a lot of people.
And hi, I'm Sue MacKay. Can you see that? Am I presenting okay?
Yeah, it's all good, Sue.
Smashing, thank you. So I'm Director of Collections and Programmes at Thackray Museum of Medicine. Just to pick up on what Jo was saying earlier about cross-sector forums, I also have a place as Museum Champion on the Culture, Health and Wellbeing Alliance, which is a national organisation, Arts Council funded, to look at arts and health. So that's commonly known as TWA. Really loads of really good resources on that site, so I'd ask you to have a look at that. And also on the management group for Leeds Arts, Health and Wellbeing, again, which loads of good resources and a great great network and lots of information. So there are those forums out there, and please do find out more. So to get going then, we're going to look at why we started on this partnership where we've embedded the social prescriber into the museum. And as a museum, first of all, this is a really important part of our mission, to be an asset to the community. Jo mentioned assets before, and we really do see ourselves as an asset to the community, particularly where we are in Hare Hills, which is one of the most diverse and dynamic and deprived wards in Leeds. So it's really important that we're useful, and social prescribing plays a part in that, as does the vaccination centre that we hosted recently, the long COVID testing that we've hosted, and delivering our wellbeing programmes. Those at the moment are our creative collection sessions, which are run through the Thriving Communities project. So that's really important. Secondly, there are lots of barriers for people, especially locally where we are, to coming into the museum. So we're on a hospital site, we're in a grand building, we're posh sounding white people engaged in learning, all very off-putting to a lot of people. So we really need all the help that we can to get local people through the doors in order to fulfil our mission. So social prescribing plays a part in that. And lastly, it really helps to us to evaluate and improve what we do. Ruth.
So on a Linking Leeds side of things, the real appeal of embedding ourselves into the museum space was this partnership came about coming out of the first kind of round of lockdowns. So a lot of the GPs in the immediate area in Hare Hills are converted family homes, so they either just simply don't have space for us to be, they don't have a room for us to function out of, or it wasn't safe for us to be there. And the Thackray had this lovely community space where there's a couple of sofas, there's, high ceilings, bright windows. It's such an inviting space. So it just solved a practical problem, firstly, and secondly, it's allowed some more creative and relaxed appointments. You're not in a clinical setting when talking about someone's life and someone's well-being. You're in a relaxed environment, which is lovely. Other parts which are really, really important for us are that it provides direct links into volunteering programs, but also Hare Hills Mondays, which is a program that the Thackray run, which is on a Monday. Admission is free for anyone who lives or works in Hare Hills, so in the local area. So that way I was able to bring residents in, have a conversation with them about their well-being, which can be a really emotional subject for some people, and send them away to enjoy the museum afterwards and have a really enjoyable kind of end part of their experience there, which was just such a positive for us. So what makes this partnership work? It's not, we found it wasn't as simple as me coming into the room and being stationed there once a week. There was a real need for embedding. And one thing that was really great was I felt part of the Thackray Museum team. So every Monday they have a team huddle. I was there, part of the team, part of the meeting. We were able to share things with one another. The space, as I said, was really inviting, really accessible. And it wasn't just the room that I would have my appointments in. So I'd have walking appointments, and there was certain displays in the museum, exhibitions about social health, about mental health. So we could use some of the displays as talking points for people to explore what was going on for them. The Thackray and Linking Leeds is also part of a Thriving Communities grant, which is all about bringing and generating new social activities based on nature, creativity and sports into the local area. So it's also this partnership and working with the museum has generated new groups for myself as a social prescriber to refer people into as well. So it's all about the embedding into the team, but also that ongoing generation of new things and being responsive to the people that come into the space. You're on mute, Sue.
Sorry. And from the museum perspective, you know, it was great to find an organisation with, you know, aims that we could align with. So we're both really keen to provide for those most in need in our hyper-local area, which is really important. And to, you know, museums are probably or perhaps best placed to do preventative work. So a lot of our work is about preventing ill health by promoting well-being. So really strong joint aims. And then again, from the museum perspective, by working together, we double the advocacy really for culture and well-being in the local area. Here we are together today. But also, that's recognised nationally. It might help attract funding. It might help attract other partners and awards. So the little quote that I've put up there is was from the judges of the Art Fund Prize. We were in the finalists in that prize last year, and they said, Thackray embodies a special type of thoughtful museum practice, positioning itself at the intersection of medical history, public health and the community, and they really appreciated that. So, you know, it really useful moving forward, thinking about future partnerships and taking up future opportunities. Sorry, I'm just having trouble moving on for some reason. I'm not sure why that is. Oh, there we go. Okay, so looking then at
Sue, you've just stopped sharing your slides. Oh,
right. Okay, start again. Sorry.
No problem. And I did put you on mute before, just because there was a bit of background noise, so apologies for that.
Oh, okay.
So it was me. But if we get some background noise, if anybody can put themselves on mute, that does usually reduce that.
Okay.
Thanks.
Sorry. Are you seeing challenges now?
Yeah, we're with you, Sue.
Great, thanks. Okay, so looking at challenges then, obviously COVID, the pandemic has interrupted, you know, all of our lives and our opportunity to work together with linking Leeds. Whilst, you know, ironically, the need for social prescribing and all sorts of inventions has, you know, increased. So so it's been a shame that we couldn't at stages continue to host, but we are going to pick that up very shortly in the future. Also during that crisis, obviously what was absolutely key was providing for the most basic needs, you know, the most urgent needs of clients, and Ruth might want to come in here and talk more about this. And so engaging social prescribing clients with what we had to offer was, you know, quite tricky. We're offering something social and something enjoyable, and a lot of clients' needs were at a much more basic level, we found. Ruth?
Yeah, so a really good point, Sue, is some of the clients we see, yes, they need social opportunities and well-being activities, but what comes first on their priority list is often a suitable place to live and enough money to feed themselves and their family, and that is the priority when you're working with someone. And it's still a relatively new relationship, really. So we've been working together for about a year. So these things do take time to embed, and these are like extra lessons that we're learning along the way. And these groups that are being generated are fantastic and need time to embed, but it doesn't mean that immediate need of the client has gone. You know, that we're still going to need to meet someone's housing needs and financial needs first, and then the well-being is obviously really, really important. We want to get to that, but there's a priority list coming in. The other challenge that we've really had on our end is, obviously with any relationship, it relies on the individuals who hold that relationship. Now, I was the wellbeing coordinator who would come every Monday and hold my clinic there, and unfortunately for the relationship, but fortunately for me, I've moved into a management position. So we've not had someone to cover due to that staff change, as well as COVID restrictions for a period now. That's due to restart in the next few weeks. But again, with any new relationship, it's future-proofing that and finding ways of really embedding this work so it becomes second nature, that there's someone there to cover it, or that the relationship isn't threatened by staff changes or ongoing restrictions, whatever that looks like.
I think, Ruth, what you're echoing is what everyone has been experiencing in that, in terms of staffing levels and getting back to normal. It's a real challenge. Yeah. We've got a minute or so, and I just wondered really, Sue, I didn't know whether you, because I know in terms of when I first met the Thackray Medical Museum, what, 5-6 years ago, you had some amazing projects around staff wellbeing for the NHS, because you sit in the footprint of Jimmy's, who, if many of you may have seen Jimmy's on TV, it's an amazing Victorian hospital, and the Thackray was the old workhouse, I think, or something like that. So there's a long-standing relationship. I wondered whether any of that work is going to be rehappening now we're coming out of the pandemic, given we know our NHS staff are on their knees and it's a real focus for a lot of organisations.
Yeah, the hospital grew out of the workhouse, actually. The workhouse was there first and provided for poor people's health, and the hospital grew around it. So yeah, very long relationship. We are just picking up on that now. We have a programme which is around a photography installation coming from the Welcome in the spring, and it's a programme called Tranquility, and we're building in LTHT sessions, particularly working there with their wellbeing coordinator. Yeah, so that's coming back, but it has been difficult up till now, I have to say, to be able to get anything going. I don't know if we've got a minute left, whether Ruth wants to run through this patient story with you.
Yeah, I'll be really brief, because this is just an example of one of the really positive things that, well, a positive example of exactly what we did. So a patient was referred to myself by the GP. They were a single parent with a child, recently moved to the UK and wanted to get to know their local area, and also for child-friendly things in their area. So I used the core community room, which is the community space in the Thackray Museum for the assessment. As I said, nice open space, sofas, so the child felt really relaxed, was running around playing with everything, and me and the client were able to have a really relaxed discussion about what they wanted. And then afterwards, I took them around to the welcome desk. The child got an activity pack and sent them on the way to the museum, and they had no idea the museum was there. And that's just one of a load of local resources we connected them with. But them actually being able to visit the museum as part of their appointment, I think, was just a real added bonus. Now, they were also considering volunteering opportunities to then build on to employment. So we talked about the volunteering opportunities. Now, this client was incredible and managed to get straight to employment within about a month of working with myself, which I don't take any credit for that. They were very, very proactive. So didn't pursue any of the volunteering, but knowing it was there and having visited the space and knowing that I could introduce them to the volunteer coordinator really, really relaxed them into it. So it was just a really positive example of how exciting and how different a social prescribing appointment in this sort of context can be.
Thank you so much. It's really fantastic listening to you guys talk, and I am so proud that you guys are in Yorkshire. So I feel quite
we've got some additionality coming up now, David. Not to steal Yorkshire's thunder, because absolutely fabulous museums, and to reiterate in terms of what Liz mentioned, over 120 museums, and that's just within their scope in terms of the ones that they look after. So do check out your local museums if you haven't already. But without further ado, we're going to extend the focus across the north of England, which is particularly privileged to have a significant number of museums and a number of national museums as well. So I'm really pleased to introduce Julia Bryan, who's going to tell us a bit about what National Museums Liverpool have been up to. And they're not new kids on the block, might I add. Their director, Carol Rogers, was at the forefront of developing international work around museums and dementia through the House of Memories. If you're not familiar with it, look it up. There's lots of resources there as well. But what Julia is going to do is to really expand on that initial journey and explore how basically they've grown into a wellbeing agenda. So without further ado, National Museums Liverpool and Julia Bryan.
Thanks very much, Jo. Can you see my slides yet? Yeah, no, it's great. Okay, so I'm participation lead at National Museums Liverpool. I've posted what the 7 sites are in the chat rather than run through them all now because it's a bit of a mouthful. Basically, what throughout the pandemic, we looked at what was needed right now, most critically, how we could be useful, as many of us did. And through that, through going online, through peddling packs out to communities, through food banks, through just providing spaces for stuff, we've learnt a lot. and that is now safe to say informing pretty much everything that we do. So what I'm going to share with you now is a formative programme. I'm not going to overplay it. This is quite early days for us, but it's a series of examples of stuff that we're ready for, ripe for social prescribing approach in partnership. So I'm just going to whiz through. I've just got the 10 minutes and to give a sense of where we're at. Okay. We've got great spaces. We are, blessed. We're already people focused. We already have an agenda of social justice at NML, and we're already, we are all about our place in history and our relationship with the world. So we're well placed to do this work. We know, as been said, so many people have experienced barriers, and we know that that number has increased through the pandemic in terms of participative activity. We are increasing our programming around neurodiversity, for example, and also realising that that approach will also benefit anyone who benefits from fantastic pre-visit information, reduced capacity, reduction in sensory overload. We've all seen a boom in home education, as some families have felt that their children or themselves have thrived through that. We're looking at why that is, trying to unpick that, trying to respond to that, which is multi-layered and very complex. We are looking at how we can respond to the crisis in mental health amongst young people. This is just one example, the Art of Wellbeing for Schools, which has become a really popular online session that we're delivering, based at the Walker Art Gallery. And we are looking at older people. I mean, Jo mentioned our House of Memories programme, which is a very established programme for dementia care, and sort of building on that really, to obviously respond to and trying to combat social isolation. We've got great immersive settings. We've got fantastic social history handling collections. Absolutely. Everything about young people isn't about memory, and sharing memories. It's also about nurturing creativity. It might even be about employability and skills. So kind of acknowledging that and creating different opportunities for that. Right now, I am looking at it as a memory programme, but I'm looking at a programme for octogenarians in Liverpool, memories of being a child in Liverpool Blitz, and looking at how we can really treasure that amongst families. And that is also about people making connections with each other. So great spaces, amazing. We've got and we've been doing, using these spaces for things like yoga and latterly mindfulness activities for a number of years. Anyway, and as Liz was talking about that, and sort of similar. We're working with HE partners at the moment, looking at how we can support stress management amongst students in terms of mindfulness, specifically in our aquarium, which has also come under my remit quite recently. We've got an aquarium and a bug house and a planetarium. We also were looking, we've got particularly our newest venue, which is the Museum of Liverpool, but others as they refurb. We've got good facilities. We've got Change of Places Leeds. We've got prayer rooms. We're looking at thinking holistically about the kind of facilities that people need and are enabling around, just like menus and baby facilities and kind of all of that. So through the pandemic, we worked on co-produced, developed and delivered out over 2,000 packs. Had some translated as well, and that's really enabled us to kind of build on, re-energize our community contacts, and we'll talk about that in a sec. We also were voted amongst an important group of young people, an organisation working with young people, one of the primary safe spaces in Liverpool, particularly citing actually our living centres. So we're considering how we can build on that to support young people. We've recently launched a young people's forum, which also many other museums have too, and looking at what we can do with them to co-produce activity. Working as Jo mentioned, the baby work, which was a fantastic highlight of last year, was Baby Week, which we produced with Jo, working with perinatal groups to create a programme for new parents. So we've recently launched tiddlers in the aquarium, we've launched mini gazers in the planetarium, working with live music now, working on the Lullaby project. And we also run every week live-a-tots in one of our dedicated early years spaces, which is Little Liverpool in the Museum of Liverpool. I think we've all acknowledged through the various lockdowns the benefits of outdoors. We've realised that, you know, that's, I mean, still a large proportion of children in our city don't have access to regular access to a green space or any outdoors. You know, that was a real problem. So looking at what bits of outdoors we've got that are under our control, and really starting to kind of exploit those as museums playing out, and looking at things like, for example, you know, archaeology community digs, what that can do in terms of volunteering for older children and adults, looking at bug hunts, looking at wildflower trails on our wildflower meadow, you know, and just getting people outdoors. And I'd say as well, running through everything we do, we have got an eye to building confidence through employability and skills as well, in case people need that, you know, in terms of getting that back on your feet and kind of, you know, trying to think about what you want to do next, really sort of kind of finding your talent, I guess. Okay, and this is my last slide. So building on the work we've done throughout the pandemic with groups who've been particularly adversely affected by COVID, we've now recently received some funding from Liverpool City Council to fund My Story Liverpool, where we're working with clinically extremely vulnerable groups to build, and others adversely affected by the pandemic, to build like their own story in a museum box. So things that creating their story of their lives over the last 2 years, kind of dwelling on the high points really, but just acknowledging that, and working also with a writer practitioner who supported us in kind of therapeutic writing around that, and then also signposting them to further activity that we have on offer as well. Okay, so that's me. I mean, I think in terms of next steps, what we're looking at is a lot of stuff has, you know, what I've been sharing with you has been largely core activity. We've also got these projects on the go, which I just mentioned, My Story Liverpool, and it's thinking about the learning from that then we can offer as a sustainable core activity, both in the 7 venues and out in the community as well. Thinking about volunteering, you know, that was all parked during COVID. We kind of need to re-energise that again, because, you know, that's got an important role in terms of building confidence and well-being. Evaluation, that's been mentioned, you know, that was kind of, we really tried during COVID. That's kind of been the last thing that people wanted to think about, we found. So, you know, actually building that really tangible evidence beyond the anecdotes has been quite challenging for us, but that's our next step. We really seriously need to think about that. And I think we've also will mentioned, you know, the importance of dedicated posts and kind of just having people, those key individuals that can be those contacts and really support people holistically. But, you know, there's quite a lot of work being done. I'm proud, and it's there to be used. That's me.
Well, everyone's been very shy in the chat, so I'm going to jump in with a question because it resonates with some things that were mentioned earlier. and it's something that the North West has in common with Yorkshire and Humber. So Julia, you briefly mentioned about your emerging relationship with Liverpool John Moores and Dr. Pamela Donaghy-Binks around social prescribing placements for undergraduate students. You happy to tell people a bit about that, and I'll share what's happened in Yorkshire as well?
Yeah, so what we're looking at the moment is for third year nursing students, looking at how we can get a regular cohort of students to be placed within our spaces. We're thinking probably primarily our early years spaces. So we've got a dedicated early years gallery in the Museum of Liverpool and also in the Walker Art Gallery, Big Art. And we work, there is some public drop-in stuff, but we also very much work with groups as well who have exclusive use of the space at that time. So creating three-way partnerships to bring in groups supported by our own staff as well that are familiar with the spaces, and also working with those student nurse practitioners. So it's kind of, that's what we're looking at the moment and trying to get in place, and we're nearly there.
So just to add some more context to that, the reason behind that was during the pandemic, most of our undergraduate clinical workforce who were part way through their degree programmes couldn't actually get the clinical placements they needed to get registration and actually practice as nurses, as doctors or allied health professionals. So nationally, the Special Interest Group for Social Prescribing for Nursing, and we say nursing plus, got together and actually worked out a formula for ensuring that we could actually get to our clinicians really early in their careers to impress upon them the importance of the wider determinants, and that by actually creating these kinds of partnerships that Julia's illustrated, we could really get them focused on social prescribing before they were into their first jobs, but also to understand when they were having conversations with patients that sometimes things that present are really symptoms and you need to dig a little bit deeper. But the other element was, and total self-interest here, we have a pandemic within a pandemic. During COVID, we've had a huge increase in maternal mortality. And what we also saw was an amplification of the existing health inequalities. So as a developed country, we have an appalling situation that if you're Black and pregnant, you're 5 times more likely to die in pregnancy. There are a whole raft of reasons for that are being unpicked. But what we know is one of the biggest issues is a lack of early engagement and sometimes some fear and lack of trust in the NHS. So we're surreptitiously working with museums to actually support playful activities where trust can be developed. And so not only are there basically undergraduate students likely to be on placement, they're developing some early engagement activity around something called ESOL Stepping Stones, which looks at health literacy messaging with some of our most disadvantaged families. And it's a stay and play style activity that works really well in a museum context. But it also allows us to wrap around some of our NHS colleagues, our midwives and health visitors, so that we create really positive engagement. And we couldn't do that without the museum support. So it is really a marriage of lots of benefits, shall we say. I'm going to hand over to David now. I can see David's hand, and I'm hoping that we're going to get some more questions. David, over to you.
Thanks. I just wondered, Julie, do you want to stop sharing your slides? And there's a question in the chat from Rachel Marsden, who's asking about referral pathways, potentially whether they're sort of self-referral within these projects. Rachel, I wonder if are you referring to the pathways for the patients to be referred into social prescribing or into the museums? I'm just wondering if there's anything more you can add on that, and who in the panel out of everyone might want to pick that up. I'm wondering, is that maybe aimed at our social prescribing service for Ruth, maybe I'm wondering if that's something that you could talk a little bit about referrals. Rachel, is it just, if you want to clarify, I'm not sure if it is in relation to referral into social prescribing service themselves.
Yes, I'm interested in how the referral pathways are established, whether that's formally in relation to, say, a PCN or a social prescribing host organisation into a service provider, which is in this case within museums and arts and culture, or whether it's happening more informally, because I think that breadth of referral is really interesting to reflect upon.
Great. Ruth, do you want to pick that up?
Yeah, so people get referred into our service through a whole host of ways. The GP can book appointments directly with our social prescribers. In this case with the museum, I had appointments set up on the system which said they were in the Thackray Museum of Medicine, so GPs could book directly in, or someone might self-refer into our service using our website or our phone number. Referring out into activities or groups, I mean, it really varies. If it's like a community group or a newly established group, it tends to be kind of an informal introduction, which means the groups that the Thackray Museum are running, I would be able to tell the client when and where they were, and perhaps do an informal introduction with the facilitator when it's running. Whereas other services or other more established groups or organisations that have a lot of groups, that might be more of a formal referral process. But all the new groups that were generated, that could be quite informal, that referral process. I hope that answers your question, Rachel.
Yeah, can I ask if it's done through, so have you got platforms that you're using specifically to do those referrals, or is it done through forms or just verbally?
Again, it can really vary. So with the Thackray groups, that tends to be just verbally to turn up to the groups because they're new and they just want people to feel like they can come along. Other groups, there might be forms. It really does depend from organisation to organisation.
Can I just add on to that in terms of the early experiences with, for example, Baby Week, which is an annual celebration and is coming 14th to 20th of November. So if you're in the north of England, it's everywhere and it's taking over the UK. But just as an example, so National Museums Liverpool was a Wellbeing journey for Baby Week, which supported lots of referrals. And it was about the preliminaries before we created referral processes. So in very much the way Ruth has described it, it's about horses for courses. People that you don't know about need to be able to access things in a variety of ways. So in some instances, community engagement team would be having a WhatsApp group and referring in. But ultimately, we sat down with National Museums Liverpool and talked about where things were going to be happening, what the numbers were like, and agreed a joint referral process. But we actually each hosted the referral process within our own domain. So we captured the audiences we were linked to, and we found people that would have fallen between the cracks, managed to get picked up in other areas. So it is around that partnership agreement and that discussion before you actually do anything. So future proofing really, but you've got to be flexible because we know that we've got a massive issue with digital divide in this country, and lots of people can't access things online. And so I don't know if Julia wants to mention about the way you're delivering My Liverpool Story, about the outreach as well, and the fact you'll come to people, and that's very much a reflection of the culture that's emerging.
Yeah, we are. We're going out to, we've been out to 5 this week, and we've got we're developing partnership with a number of our local hospitals. Some of them because they're clinically very vulnerable as patients in individual rooms, and that's going to be a digital project. But it's all the same thing. So we're delivering the actual materials to them, and then delivering the session digitally. So they're all quite complex to set up, but we are, and we're planning on continuing it. We're going to try and find funding to continue it once the Liverpool City Council funding runs out, because it's been so incredibly well received and it's feeling really important.
So there's a quick reflection and another question that's just come in. One of the referral pathways that we really try to promote, Rachel, is from reception in GP surgeries. And actually, the key elements within the social prescribing sort of approach funded through the DES is that patients can access it easily. So self-referral. So hopefully if they contact your general practice, the reception could then book a slot and we don't have a GP appointment involved. So I think we do need to make it as easy as possible to get access. James has put something, if he's just trying to work out if the strategic direction is to eventually have someone authorised to prescribe in the museum, I mean socially prescribe. Does anybody want to pick
Shall I answer that, David?
Yeah.
So back in 2013, well, I still work for Health Education England, which is the workforce arm of the NHS. They wanted to understand what a social prescribing landscape would look like for their own clinical people. And as part of that process, we drew together 8 different typologies of social prescribing wellbeing journeys. And in some areas, some like advice on prescription. So when Ruth mentioned about those really basic needs around people, I've got debt, need somewhere to live. That was always number one, because it's like Maslow's hierarchy. You've got to deal with those issues before anyone else can deal with anything. But also people that have got a lot going on do need distractions and need to have moments of joy. So it's often more difficult to embed some of those things that are often seen as frappery, which we really do all too often dismiss culture as not being significant. But actually, we know from the evidence base, from whether it's the all-party parliamentary group, where chewers work, etc., that there's so much evidence that actually by making and doing, we actually grow our own well-being. So within the Health Education England publication, Social Prescribing at a Glance, what you've got is museums on prescription very up there and arts on prescription. And it was really as validation to people that actually it's all right to explore these. These are valid journeys. It's about what you create together in your localities, because you'll all have different assets. And in the same way, volunteering on prescription was in there. So if you've not seen it, James, you can Google it. It's Health Education England, and it sets the context. And then the next thing to do is to look at the all-party parliamentary groups work around the creative health agenda and the creative health inquiry, which will then take you to the types of journeys and the evidence base. But yes, to answer your question, the strategic direction is it's having it up there, that we know that for women who've got postnatal depression, the best thing you can possibly do to them is to direct them into motherhood and melodies or music programs in group context. And 3 months after the program's completed, the postnatal depression's not returned. But basically, if you compare that with talking therapies and or pharmaceutical interventions, as soon as the intervention stopped, i.e. the therapy and or the drugs, you're potentially back at the beginning. But what creative inquiries and creative encounters do is give people agency and the resilience to bounce back. So yeah, that is the strategic direction.
Thanks, Jo. Ruth, do you want to come in?
Yeah, I wanted to add to some things Jo mentioned there about I've forgotten the hierarchy of needs, where, yeah, obviously there's some urgent practical stuff that we often get faced with, but some other work we've done in order to equip our wellbeing coordinators with the tools they need to prioritise adding joy into people's lives, promoting these creative things, and, you know, strengthening the relationship with the Thackray have been putting a few of our wellbeing coordinators through an art program, and then the Thackray hosted us to then share that finding with the rest of the team and have a creative afternoon as wellbeing coordinators. And I think it kind of comes back to working in our silos. We get very fixed on, right, we've got to prescribe someone to their housing or their finance or their, like, everything that we know of in health and social care, but taking the time to really immerse our wellbeing coordinators in the creative side, and also being in a museum context and seeing how that feels, has really increased our referrals out into these sorts of programs. So just some additional ideas on how you can embed that in whatever service you're working with.
Thanks, Ruth. So important to reference all of that in terms of Maslow's hierarchy of need. And Sue, did you want to come in and add to that?
Yeah, just to say that the the training film was put together by the art doctors in Leeds, who've been around a few years now and doing absolutely great work. And I'm sure that training that they did will be able to be shared through the Thriving Communities project that we've done in East Leeds, led by Space 2. So have a look for Art Doctors, Thriving Communities Space 2 if you want to follow up on that, or contact me or Ruth if you're interested in how that training might be delivered more widely.
Can I just add as well, I've just put into the chat, it's one of the best kept secrets on the planet. It's something called uplifting resources for NHS staff. Because what Ruth's touched on is that we know our link workers are under incredible pressure, as our health and social care staff, and actually we neglect our key healthcare professional staff, and so do museums as well. So a key plank of Liz's work has been around not only the well-being of the audiences who come to the museums, but actually looking at what's good for the goose is good for the gander. And the uplifting resources was a good example of how a creative intervention using reading, poetry and writing has actually been developed directly for NHS staff. But if you go into it, I can recommend it. It's good for everybody. So we need to stop thinking about people as being staff, patients, and in museums, etc. We're all likely to be patients at some point in our lives, and we all have the same needs. And so we can upcycle those resources for ourselves and our communities.
Excellent. I'm just going to flash up. We've got the last few minutes now. We wanted to do a bit of a sort of snapshot at the start and then follow up with a bit of a baseline. And there's one more question after this. So hopefully you're now seeing the Mentimeter. So please do tell us now, how confident do you now feel about explaining museums on subscription? We've got a question from Esther as well, and Esther's mentioned something about volunteering, which is I'm wondering if anyone can help pick that up. It'd be also good to just sort of mention really these great opportunities. We know around the country there's more and more link workers being recruited, and surgeries have not got enough space. So there does seems to be a real win-win here with opportunities. Can anyone pick up that question from Esther?
Yes, it's a really pertinent point. So, because what we often found is that volunteers in the arts, and particularly in museums, tend to be older people in their third age, and often they were the most vulnerable groups during the pandemic. So they literally had to step back. There's something called the Northern Volunteer Pass across Yorkshire, which is housed through, and Sue, you'll put me right, I'm sure it's York Archaeological Trust who host the actual programme, and it's all Yorkshire museums, and it actually extends beyond Yorkshire. So what I'll do, Esther, is if you want to email me, my contact details are all within the badging system. I'll put you in contact with them, and there's a few other initiatives in place as well. But not least, it's a really good anchor point back to NHS and Health Education England. The NHS has some of the biggest volunteer schemes, and one of the biggest benefits a couple of years ago was connecting Health Education England's volunteer scheme with the oh gosh, it's gone out of my head now, it's the Imperial War Museum in Manchester. And we actually joined up some conversations, and they actually created almost a virtuous circle, and we're able to provide different opportunities for different groups of volunteers who could be moved between the programmes. And again, I can share the report on some of that work. So again, it's just a good example of that. We don't sometimes see what's already there, and if we can connect it up, we just all get a bit more firepower.
Brilliant. I'm gonna just flag James's question about link workers receiving motivational interviewing techniques. Ideally, we would like them to have that training, and Ruth mentioned there that all the staff in Lincoln Leeds are. I think to say 100% of staff have had that training, you know, certainly it's a desirable within the NHS England's job description of a link worker. In terms of the last couple of minutes, I know we've lost one person who's had to jump off. Just to kind of pull your attention to this, sorry, just to pull your attention to the fact we've got nobody saying they're not confident anymore, Jo, which is brilliant.
Excellent.
Yeah.
Well, Deborah's question's quite relevant because she's asking about her visits. I wondered if she'd tell me where she is.
While we're doing that, I'm just going to move us on because it's got 1 minute left. Can you tell us now, how do you feel about exploring this in terms of next steps around museums on prescription? So you can, hopefully we can see a few words getting submitted just while that question is percolating through. And if anybody wants to jump in on that one, it'd be great to kind of hear how you're feeling. Hey, wonderful.
And I wondered if Ruth Ann's still about, whether she might post something about her amazing project using cultural interventions in a university context at Edinburgh Museum. And that's another approach that has really inspired a lot of museums about the opportunities for collaboration. If she hasn't, when we do the follow-up, I'll put some links together for everyone to follow through. I think we might have lost Deborah, so we can pick that up separately. No.
No, I'm still here.
Oh. Whereabouts are you?
Oh, I just put it in the chat. Sorry. And I cover 4 surgeries in Swindon and Wiltshire and Oxfordshire. But I'm willing to travel.
Well, there's lots of stuff happening in your area. So I think probably the easiest thing to do is, in relation to Liz Denton's initial presentation, you will have the equivalent of Liz in your locality. And I would start there first and come back to us if you have any issues. Because we had some presentations at Museum Development Yorkshire from the Southeast and London, and we've had them from, well, everywhere throughout the year because we're trying to improve communications across the UK. So, and as someone that supported the National Museum's Wellbeing programme, which was the precursor to TUA that Sue mentioned, we've definitely got wellbeing opportunity near to you in every museum. It's just, it's often not that obvious if you don't know it's there.
Brilliant, thank you.
Just to say, you know, we're going to be finishing the recording shortly. If you have any final comments or reflections, please do share them in the chat or drop them into the meet. But just to thank all of our presenters for coming on, sharing their journeys, and the slides materials will all be uploaded to the website. And yeah, it's been really fantastic having you all here today. What a lovely journey, you know, and thanks to Jo as well for helping to pull all this together. It's been lovely working with you again, Jo.
And always a pleasure working with you, David.
Thanks so much, guys.
Working to strengths, isn't it? And proper partnership and collaboration. That's the secret for a good journey.
So if we can stop the recording now, and you know, there's been some information shared about the Air Meet Lounge as well, which will be going on up until 6 PM today, in the chat by the Social Prescribing Network, and that really is just to remind you that you can access the awards as well. But at 3:30, there's going to be some social prescribing awards. But please do use the Air Meet Lounges as well, because they are much fun. Oh, Veronica, hello.
Just a quickie. My chat didn't work, and I was longing to comment, but I don't know if anybody else had that problem. But the chat didn't work.
Sometimes technology doesn't always work, but please do. I am sorry. I'm going to have to jump off.
I'll stay. Hi, Veronica.
Hello. It was brilliant.
Bye, guys. Thanks so much.